My name's Dr. Andy Lee, and I'm the neuro-ophthalmologist here at Houston Methodist Hospital. And today we're going to be talking about a cranial nerve problem. And the cranial nerve we're going to be talking about is number 3. So this third nerve, the cranial nerve, supplies the eye movement, the pupil, and the lid. So we have to look at all 3 when we're looking at third nerve palsy. And so in this diagram, this right pupil versus this left pupil is bigger because it's dilated, and that's a pupil-involved palsy. And because the third nerve controls the eye movement as well of the muscles that move your eye, medial rectus, superior rectus, inferior oblique, inferior rectus, but not the lateral rectus, the eye is turned out and is down. So down and out. So that's going to be an exotropia and a hypotropia usually. And the other eye is going to be straight. So pupil and muscles, and then finally the lid. So in a patient who has a third nerve palsy, the lid will be down. So normal and then abnormal with the ptosis. So ptosis plus misalignment plus pupil are the 3 components of the third nerve palsy. And the reason it's important is the third nerve runs from your midbrain. So here's the midbrain in section. And that nerve comes out of your brainstem and is trying to go to your eyeballs and make your eye move. And so it's got this subarachnoid portion. In this location here, aneurysm can press on the nerve and cause a pupil-involved third nerve palsy. And then it's going to go to the muscles that move the eye, or the 2 muscles, and innervate the pupil. And this is the ganglion. So this is cranial nerve number 3. And so when you have a third nerve palsy, it can be damage to the brainstem, it can be damage to the nerve in the subarachnoid space, it can be in the cavernous sinus, or it can be in the orbit. And so the workup for a cranial nerve 3 palsy is to do an imaging study. And normally that imaging study initially is a CAT scan, but we have to have an angiogram associated with that CAT scan because we're worried about this aneurysm. So anybody who has a third nerve palsy, ptosis, pupil involvement, ocular misalignment, we're going to start with a non-contrast CT of the head to make sure it's not a subarachnoid hemorrhage or an intracranial bleed, and then follow immediately with a contrast CTA to look for this aneurysm. And if it's negative, we're going to do an MRI plus an MR angiogram because there are other things that can cause a third nerve palsy that have nothing to do with the aneurysm, an infarct in your brainstem, a cavernous sinus mass, an orbital lesion. But the key thing is you need to have an A to find the A. The A we're looking for is aneurysm, and that is the rule of the pupil. And the A to find it is angiogram. And normally we're going to start with non-catheter-based angiography, CTA, MRA, but some patients still need to have a catheter dye injection digital subtraction angiogram. So you need an A angiogram to find the A aneurysm. This is the rule of the pupil, by the way. A pupil-involved third nerve palsy is an aneurysm of that artery right there, which is the posterior communicating artery, PCOM artery, until proven otherwise. So it typically presents as droopy eyelid, big pupil, ocular misalignment, double vision. If you see this cranial nerve 3 palsy, you have to image it. CT, CTA as our first line, MRI, MRA follows to look for non-aneurysmal causes. Some people still need to have an angiogram to make sure it's not this aneurysm. And if it is the aneurysm, if we treat it, it's a cure. If we let it rupture, half those people die at the scene. Of the people who make it to the hospital, half of those people are permanently neurologically impaired. And therefore, it's really important that you know what a cranial nerve 3 palsy looks like. Then you know it's an emergent evaluation, CT, CTA, MRI, MRA, and that the thing we need to make sure it's not is that aneurysm.